Thank you, and I am delighted to be here tonight and honored to present this year's Frontline Heroes Award. Our admired recipient is Mothers to Mothers, and it's 1,500 mentor mothers who work every day on the front lines to eliminate pediatric AIDS. For more than a century, Johnson & Johnson has dedicated resources to improve the health of mothers and their babies. We believe that every baby needs a healthy mother, and every healthy mother has a dream for her child. And so, J&J has made a deep and enduring commitment to ending pediatric AIDS. Our vision is a world in which no baby is born with HIV, and no child loses its mother, which is why Johnson & Johnson is so proud to support Mothers to Mothers. Founded in 2001, Mothers to Mothers is dedicated to eliminating mother-to-child transmission of HIV and supporting the health and well-being of mothers and children. It achieves these goals through mentor mothers and an extraordinary core of more than 1,500 HIV-positive moms and advocates employed by Mothers to Mothers and trained to educate recently diagnosed HIV-positive pregnant women and new moms. One mom at a time, a mentor mother relates and responds. She shares and supports. One mom at a time, she fights HIV. And mentor mothers are role models in their community, countering stigma and gaining a measure of economic independence that greatly improves their lives. Women who are counseled by mentor mothers are more likely to disclose their HIV status, to pursue HIV treatment, and monitor the progression of their infection. They are more likely to deliver their babies in healthcare facilities than mothers who do not regularly visit a Mothers to Mothers site. Since its founding, Mothers to Mothers has reached more than 1 million women and has grown from one site in Cape Town, South Africa, to more than 600 sites in 7 countries in sub-Saharan Africa. This small but fierce group of frontline heroes, with their modest uniforms, essential skills, and unmatched empathy, are easily recognized by the mothers who need them and appreciated by the doctors and nurses with whom they work alongside. And they are the embodiment of an elegantly simple truth. When it comes to protecting infants from HIV, mothers are the key and a global force for good. Many of us here tonight are part of the global plan to reduce the number of new HIV infections among children by 90% and reduce their number of AIDS-related maternal deaths by 50%, both by 2015. It's called the Global Plan, and it has all the benchmarks and stakeholder commitments you would expect, but truly, it is a global opportunity. Together, we have the rare and welcome chance to achieve a meaningful legacy. We can say that pediatric AIDS ended on our watch. We have the medicine, the methods, and a plan. The time is now, and Mothers to Mothers will help lead the way, because big modern problems can have time-honored solutions, such as the power of one woman sitting with another, offering compassion through shared experience. These exceptional mentor mothers have witnessed firsthand the action that follows information, the hope offered by opportunity. So please join me in welcoming one of these amazing women, Tululane Pukodede.
Good evening, ladies and gentlemen, and thank you. My name is Tlalane Pafudi. I come from the mountain kingdom of Lesotho. I'm a mother and I'm living with HIV. And because I'm a mentor mother working for Mothers to Mothers, I believe in the power of mothers. That together we can eliminate pediatric AIDS and keep mothers alive. Almost 10 years ago, my fiancé gotten very sick, even though we can see because he had full-blown AIDS symptoms, he refused to test because of the stigma and discrimination surrounding HIV and AIDS. After nursing him for weeks, he lost the fight and he died in my arms. I knew that I needed to get tested. So to run away from the stigma and discrimination, I traveled 430 kilometers to Johannesburg in the neighboring country of South Africa, where nobody knew who I was. Sadly, even though I was hoping for a miracle, I did test positive that very same year that my fiancé died. I had only two choices. I could either take my own life by means of suicide because I didn't want to suffer the way that he suffered, or I could take control of my life. I decided to live. And I realized that I needed support. So I went back home. I told my mother and my sister, and I'm very grateful that they gave me their support. 6 years later, in 2009, I had a new partner in my life, and I suspected that I was going to become a mother for the very first time. As you can imagine, I was very excited, but at the very same time, devastated because of my HIV status. So I didn't know what to do. I went for my prenatal checkup. I was given treatment to prevent the virus to transmitting to my child, but the instructions and directions on the treatment were overwhelming. And hospitals and clinics can be very frightening places, so I was scared to ask. So every time I'll leave the hospital, I'll be very confused because I honestly didn't know what to do with treatment. It was only after my baby was born that I met with Mothers to Mothers. From Mothers to Mothers, I learned about pediatric AIDS and how it can be prevented. I learned how to feed my baby. They encouraged me to disclose my status to my partner, and they taught me the importance of family planning. They also encouraged me to have regular CD4 count tests and my baby's HIV test. And the mentor mother was there for me whenever I was feeling discouraged and alone. I realized how helpful it would have been had I had Mothers to Mothers services during my pregnancy. I realized how important it is to support HIV pregnant women, to protect new lives, to protect the hope that every mother has for a healthy child. It is for this reason that I became a mentor mother, to ensure that all women in my community have all the support, the treatment that they need and they deserve. As a mentor mother, I educate women about HIV and AIDS. I educate them about prevention of mother-to-child transmission of HIV. I encourage and empower women, helping them to overcome the stigma, disclose their status, become role models in their communities by living healthy lives. am a living proof that HIV and AIDS is no longer a death sentence. I am a mother of a very healthy child who is HIV negative. At the clinic that I work, the nurses and the head nurse tells me that before Mothers to Mothers program was implemented, they used to have babies born with HIV on a daily basis. It wasn't surprising to them anymore to see a baby born HIV. But since 2.5 years ago, when we started the program at the clinic where I am, we have only had 2 babies born with HIV. And ladies and gentlemen, that is not by chance, it is because of care. The Mothers to Mothers model works. It saves lives. I am so honored to be here tonight and to accept this award, not only on behalf of Mothers to Mothers, but on the behalf of the 1,500 mentor mothers like me and almost 250,000 pregnant women and new mothers that we reach every year, each of whom is living to see their own children grow and become whatever they want to be in life. It would not have been possible without the support of Johnson & Johnson, a company that has supported us, that has supported Mothers to Mothers with extraordinary enthusiasm and generosity. A company that shares our dream for a world in which no baby is born with HIV. Ladies and gentlemen, we really are grateful to Johnson & Johnson. And I would like to thank GBC Health and everyone here tonight for recognizing the power and the potential of women and mothers, and for your investments in healthy populations and bright futures. Without your support, I would not be here. I would not have realized a lifelong dream of visiting your beautiful country, and I would not have a beautiful, healthy daughter to return to. Ladies and gentlemen, ke a leboha. Thank you.